When we look at global population growth, we often see it as a force of nature, something organic and inevitable. But the data reveals a different reality. Population growth functions as a mechanical system, driven by specific, hidden forces. It is a system that can be mapped, diagnosed, and engineered. We call this the demographic blueprint. This Bongaarts projection models global population to 2100, showing a significant divergence based on policy choices. The 4.6 billion gap between these outcomes is the structural governor of global growth, driven by unintended childbearing over the next 8 decades. While variables like mortality and migration are significant, this projection indicates that the success of family planning is a primary determinant of the eventual size of the human race. To manage these dynamics, states typically focus on the physical infrastructure, the clinics, the supply chains, and clinical contraception. This is the hardware of demographics. But standard development policy frequently hits a wall. Building hardware fails if the corresponding software, reproductive health, is missing. Its core engine is autonomy, the right to decide when to reproduce. Currently, only 52 to 55% of women possess these autonomous choices. To understand why demographic policies succeed or collapse, we have to look past the hospital infrastructure and diagnose the sociology of the individual household. This diagram outlines John Bongaarts' proximate determinants framework. It demonstrates that fertility is restricted by activating 4 specific behavioral and clinical valves. Valve 1 is contraceptive use. It is the master valve, driving 75% of the fertility decline seen in Latin America. Closing that valve provides a massive macroeconomic incentive. It lowers dependency ratios, which triggers a surge in the working-age population, the exact demographic shift that fueled the East Asian economic surge. Yet, this mechanism is often obstructed. These 4 pillars, patriarchal norms, religious opposition, cultural myths, and funding gaps, act as a barrier against demographic modernization. Successful states like Bangladesh didn't wait for these cultural blockades to erode. They bypassed them. This diagram contrasts the failed model of distant clinics with a successful grassroots alternative. Instead of expecting women to navigate patriarchal restrictions to reach a clinic, they deployed 50,000 female health workers directly into rural households to distribute supplies. Economic hardware is actively sabotaged by cultural software. Achieving demographic stability requires an active bypass of patriarchal infrastructure. This creates a severe systemic mismatch. This comparison shows rapidly modernizing economic hardware, like mechanized farming and hospitals, clashing with rigidly traditional cultural software. For decades, development economists operated under the poverty hypothesis, the belief that families neglected girls because they were too poor to feed all their children. The data from Punjab debunks this. As wealth increased, female mortality imbalances actually worsened, especially among affluent families. Even high female labor participation offered no protection. Earning a wage is meaningless if women do not control the actual assets. The root cause is a cultural rule: zero reciprocity. Dowries and support flow out to the marital home. This one-way flow means a daughter's economic contribution to her birth parents is structurally reduced to zero. She is viewed purely as a transitory component. Wealth cannot save daughters in a system where their long-term economic value is forcefully erased by cultural roles. This data shifts our analytical framework. We are not seeing a broad, unconscious bias against all females. We are seeing strategic attrition, calculated household decisions aimed at specific children to achieve a specific family composition. This calculation accelerates under the fertility squeeze. As families desire fewer children, the pressure to ensure those remaining 1 or 2 slots are male intensifies exponentially. This heat map pinpoints who bears the mortal risk of that squeeze. The highest danger falls on subsequent daughters, females born after a surviving sister. Modern medical technology allows this attrition to move upstream. It begins as postnatal nutritional neglect and unequal pediatric care, but evolves into prenatal sex-selective abortions. This leads to a disturbing finding regarding maternal agency. What happens when mothers within these patriarchal systems gain a higher education? The data shows a 136% mortality gap spike for subsequent daughters born to educated mothers. Increased female agency, without dismantling the patriarchal structure, merely optimizes the execution of the cultural mandate for sons. When millions of households make these calculated decisions, the micro-level attrition scales up, fracturing the macro architecture of the nation. This creates a massive, unnatural surplus of men and a deficit of female workers. That imbalance causes three distinct macro fractures: a structural marriage squeeze, a suffocated demographic dividend, and systemic spikes in crime and localized violence. These cultural biases scale into a national threat. They create a mathematical pathway to demographic crisis and institutional destabilization. The central diagnostic lesson is clear. Building a clinic does not guarantee a patient. The clinical hardware of supply must be matched by the cultural software of social autonomy. To achieve sustainable demography and sustained economic growth, states must adopt a comprehensive policy blueprint. This requires legal and structural reforms that enforce equal inheritance and financially decouple family building from gender bias. This chart traces the logical sequence of empowerment. Removing structural barriers for women allows nations to capitalize on the demographic dividend and accelerate economic performance. Investing in female structural empowerment is an ethical imperative, but more importantly for the modernizing world, it is the single most effective macroeconomic and population policy available.